He's always um, he's always been by our side and helping us decide on what ceremonies that we needed to do in order to launch some new resources, or how to create new resources, or who to involve in creating new resources. So we really appreciated him, and he appreciated being involved with the work that we did. For almost 40 years, we've worked together in doing this kind of work, ensuring that Indigenous people um, learn from the science of health and wellness. With that, I am from the Titkit Nation. My father's Titkit, my mother's Nkwakwa. I currently reside on the ceded territory of the Tsawwassen First Nation and unceded territory of the Musqueam peoples here in this little village called Ladner. I am a retired RN and have been working in healthcare for about the last 40 years, and really appreciated all the learnings throughout my career, and appreciate you all here and your willingness to share and learn together, specifically on this breastfeeding week. A really important topic to us. It's about health promotion. It's about our first traditional foods, and how to keep our family strong. With that, I will hand it over to Barb and Toni, who will introduce today. Thank you.
Great, Lucy. Thanks. So, Toni, do you want to go first?
Sure. As well, my English name is Toni Winterhoff. My homework is A, planning. My role here at the FNHA is Healthy Children Specialist, which means I get to support all kinds of fun work through maternal child health home visitation, FASD, the Lego Family Home Visitation Project, and anything else that pops up from zero to through the early years. I'm joining you today as an Indigenous nurse, but as well as an Indigenous mother who has had barriers along my breastfeeding journey. And Barb and I will be modeling having some empowering conversations today. Thank you so much for taking the time. I'm going to throw a question in the chat for you to consider while we present, and I really invite your feedback at the end. Thank you.
Thanks, Toni. And I'm Barb Webster. I'm a white uninvited settler guest on these lands, and I'm calling in today, and I work and live on the unceded traditional territories of the Musqueam, Squamish, and Tsleil-Waututh people, and honored to be able to live on these lands. My role at FNHA is clinical nurse specialist for maternal child, early childhood, and I've been at FNHA for 9 years now. So the plan for today around empowering conversations is, as Toni says, we're going to be role modeling, role playing some scenarios. So we have 4 different scenarios that we've come up with, and just again, obviously this is less than an hour presentation, so it's really just to kind of give some ideas to you and not go into the depth of each of these different subjects that we're talking about, but just more of sort of how to introduce some of the conversations and some of the ways you can ask questions that may help you, give you some ideas. We're certainly open to other ideas. Feel free to put things in the chat. And as you can see, I've already downloaded a whole load of stuff in the chat since I'll be talking today, so I can't do it at the same time as a presentation. Feel free to enter anything else if there's other things that you have found that are helpful to you. So on that note, we'll start off with our first role play, where I'm going to be the mom and Toni is my nurse.
Our first topic is a pretty common one. It's just having a conversation with a new mom who may be apprehensive about breastfeeding. As we move forward, we just wanted to highlight for you a few small tips and tricks. You may be a very experienced community health nurse. You may not have had this role yet, supporting new moms. And so as we engage in conversation with new moms, the things that I try to remember are stay curious about mom and her journey, be relational first. Everything that I do is relationship first, particularly nursing. And then I always remind myself that I am being invited, honored, and trusted to walk on this journey with mom, to be her advocate and champion. So just that reminder that it's a privilege to walk with a mom on her journey. I never take the position of I might know better or I'm the holder of the knowledge ever. And so just those small tips as we move forward. Our first scenario, I will be a community health nurse, and Barb is coming in with some apprehension about breastfeeding. So welcome, Barb.
Hi.
I'm so happy we get to share some time today. I understand that you have some questions or curiosities about breastfeeding, and I just want to thank you for coming in and having this conversation.
Yeah, I've heard all the good things about breastfeeding, but I'm just worried about it because I've really never had anything to do with breastfeeding and haven't seen any friends breastfeed. I'm an only child, so didn't have any siblings breastfeeding. And so, yeah, and I've heard, you go on good old Google things and on Facebook and all these other social media sites and hear some horror stories too. So yeah, so it's making me a little bit nervous.
That's a very common worry. And I'm hearing the love and concern for your baby. I just want to acknowledge that it's normal to feel uncertain, especially the first time. Though I will say, could be the second, third, fourth time too. The first thing I want to ask, you've shared a little bit about your history with breastfeeding and your knowledge, but I don't want to assume anything. So can I ask, is there any family or maybe community, cultural teachings or traditions around this that you would like to share before we begin?
Not really, except that I know in my mom bottle fed and my grandmother breastfed. And I think when I talked to my mom, a lot of the people that she in her generation basically were formula feeding. So, they're coming with that framework because when I mentioned about wanting to breastfeed, they're like, why are you going to do that sort of thing? So, yeah. And just a side note, since I'm not First Nations, perhaps, if for having with a mom who was First Nations, hopefully they would sort of jump into some of their cultural teachings or, what happens in their community. I'm just a generic Canadian that doesn't have really any strong cultural background to pull from that's applicable to breastfeeding. So, but just to keep that in mind, I'm just kind of doing this as a non-Indigenous person. So I'm a bit short on discussing the cultural part for me as a mom, because I'm my role play.
No problem. Thanks for that disclosure.
Yeah.
Okay, well, thank you for sharing that with me. Let's talk about a few reassuring facts. The first is your body is designed to produce the right amount of milk for your baby. As long as your baby's latching correctly, they're likely going to get what they need. And I say likely, there is always a small percentage where they struggle, and we can definitely talk about how we can overcome some of those. The first thing that I was hoping we could go over was some signs that baby's getting enough milk, because I did hear in your words you're not sure about that. So the first thing that we want to look for is frequent and wet diapers, anywhere from 6 to 8 in a day, regular bowel movements, weight gain consistent with the growth charts. I actually have one here today that we can do if you like, and you can take a copy home. I'll also have a copy here for our visits. Things that we can look for from baby are they're seeming satisfied after feeds. And I just want to remind you that babies have teeny tiny stomachs and they feed very often. The great news about that is frequent feeding stimulates more milk production. Again, your body knows how to do this and knows what to do. But if you're still concerned, I'm here to walk on this journey with you. And I would love to share more information on breastfeeding. If you are experiencing concerns, we can check baby's latch as often as you want to. We can discuss feeding positions. I have a little doll here. I can show you a couple of positions that you can try. Every baby is different, just like every person is different. They have different ways they like to eat, different places. And so it's part of that journey is getting to know both you and baby and what's going to work best for both of you. If you're feeling apprehensive about getting enough milk, we can also track feeds and diaper output. I will confess I did do that with my first for a whole month. I was very new and nervous to breastfeeding, and I just found it reassuring to track that. And then I kind of got into the swing of things, and I was able to track their weight. And then the other thing we can do is we can do regular weight checks, again, as often as you like. It's always fun. So I just want to say that breastfeeding can be a challenge for some, but with support, again, most women succeed. And don't hesitate to ask for help on this journey. I'm here for you and your baby. We're all here for you guys to thrive. I have this breastfeeding tips sheet here. Can I give it to you with the growth chart today?
That would be wonderful. Thanks. Yes.
Is there anything that you would like to go over that I mentioned?
No, I think if there's things I can read, that would be great. Or if there's any websites that you recommend, that I could go to. Otherwise, I think I just need to, I'm probably going to be putting you on speed dial after the baby's born. As far as figuring out how it's going once the baby's born.
Well, that's what I'm here for. And I just want to say, I really see you taking the time to look into this and thinking about your baby and your goals. And it's just an honor to be a part of this journey. So thanks, Barb.
Thanks. We'll be in touch.
Okay, guys, that's our first conversation. We started off with a little bit of a softball. But before we move on to our next scenario, does anybody have any questions or anything that might have flagged for them?
I've just put a couple of things in the comments and I thought I might read them aloud just to stimulate some other people to put some comments too. So I really loved the way you reminded us that we are privileged and not the knowledge holders. So I really will carry that with me. And I love the way you said, I don't want to assume. I think that just emphasizes so much about, we're going in open-minded. And I love the way you just finished with, I really see you and the time you're putting into looking into this. The respect in that, where it's not that attitude of, oh, this person is looking for help, they're having a difficult time. But no, it's like, I respect you for seeking help and well, not even seeking help, for looking into this. So thank you. And yeah, just encourage other people to put into the chat if there's things that, I'll just read out the question that Toni put here at the beginning. She said, for today's discussion, we would love to hear at the end of this session, what is something that we have said to you or have heard about breastfeeding that was impactful? So you're welcome to put those in during that discussion.
And I must say, we failed to allow you, Aidan, to introduce yourself.
Oh my gosh.
Yeah. You're part of a
That's a-
team that put together this whole webinar series. So perhaps we'll just take a pause for a moment and just let Aiden.
Okay, just very
Hello?
briefly, my name's Aidan Farrow. My pronouns are they and them. I'm an uninvited guest to the Esquimalt and Songhees territories of the Lesquangan people speaking, otherwise known as Victoria. I was born and raised in Australia on Ngunnawal country, so I'm also a newcomer to Vancouver Island. And I'm a lactation consultant, very passionate about infant feeding, not just breastfeeding and chest feeding, but infant feeding, right through to introducing solids and early childhood. So yes, thank you for asking me to introduce myself.
Thanks. And sorry, we didn't do that at the beginning. We'll get it straight by the 5th day. That's why we're doing multiple days. Just to finish off the first role play or session, there is in the chat one of the documents that Toni was talking about around the breastfeeding baby guide, showing how many pees and poops that can be given out to parents to help guide them as far as recognizing what's sort of quote within the norm or expectations. So yeah, okay. Moving right along here.
Okay, so for our next conversation, I'll be wearing my nursing hat one more time. And Barb will be coming in as a mother who is currently using cannabis and, as a spoiler alert, hopes or plans to continue using cannabis during breastfeeding. Before we head into this, I do want to acknowledge that this is a relatively new area as far as it being legal and much more open in conversation. But we're in a difficult counterpoint where we don't have a lot of publications, much like FASD, on the conclusive studies on the long-term effects of cannabis use during breastfeeding. I also want to preface this by saying that I acknowledge these conversations put you in a really hard place sometimes. For myself, when this has come forward, I remind myself that I'm on this journey with mom, and I am definitely keeping my eyes open for safety for baby. But I'm holding mom first, and I'm supporting her because I acknowledge and I know in my heart that when moms do better, babies do better. So it's my job to show up for that mom in that moment. But I do just want to say that I acknowledge there's some tricky conversations and some hard places that you might be put in when it comes to substance use and having these conversations. I invite you to tread softly, trust in your own gut, trust your college and your peers. But if we can remember to keep those eyes on mom first, so long as it's safe, and move forward from there. So now I'm gonna. Okay. Hi, Barb.
Hi.
I understand that you have some questions about breastfeeding during cannabis use. And I just want to say I'm so happy that you brought this up. And I'm really grateful for the opportunity to have this conversation. Let's discuss this openly and factually with the understanding that we are in a safe space right now.
Okay. Yeah,
Um,
so
No, please.
no. Yeah, so I use cannabis. My partner uses cannabis. Our friends use it. And I'm hearing, lots of different stories about whether or not I can breastfeed, because I was really hoping to breastfeed because I know that's the best for baby. And but I'm getting mixed messages. And some people say it's safe, and the government's just telling us all these horror stories, and they don't really know what they're talking about. And then I hear other things that it's not safe. So someone suggested I come and talk to you.
Thank you for that. I agree, it can be really confusing. There's a lot of sources of information, and there's a lot of different viewpoints. What I do love is hearing you focused on what's best for your baby. So even though there's a lot of noise around you, I'm hearing you really got your heart and your ears and your mind locked in to how can we move forward in the safest possible way. Firstly, it is important to know that THC, that's the main ingredient in cannabis, it can pass through breast milk to your baby. The amount kind of depends on a few factors, like the frequency of use, even the potency or the strength of the cannabis. And one thing about cannabis that I didn't know until it became much more commonly spoken about, and I started doing more research, was that THC actually can bond to fat cells in your body. And unlike alcohol, where there's a pretty quick decline in the amount that can enter your breast milk, THC can actually be transferred through your breast milk for up to 6 weeks after use.
Oh, really? Oh, wow.
Yeah, that was new information for me too.
Yeah. Hmm.
So current medical guidelines, they do advise against using cannabis while breastfeeding due to potential risks to baby. And that could be both on brain development and behavior. I understand why it would be confusing because there is a lot of sources of information out there. I have a few resources that I'd love to recommend for you. Maybe you could have a look at them and see how they fit.
Okay. Okay.
Wonderful. So we're just going to pause to let you guys know that those resources that are listed on the side as BC Center for Excellence in Women's Health has a phenomenal brochure. That is what I would myself would be providing. So can I ask Barb, and there's no pressure to answer right now, but have you thought about one way or the other if you intend to continue smoking?
Yeah, I mean, I guess I really want to breastfeed, but I guess I feel pressures to kind of keep using because, as I say, my partner uses, and we have friends come over and they all get together and they use, and so I'm just finding, it's hard to kind of tell all these people that I don't want to do it anymore. And so I'm just wondering if you have any ideas of how I can, talk about it. When I bring it up, it gets into, we sometimes fight over it. So, yeah. So as a result, I'm kind of just torn, to be honest.
That's not an easy road. I love that you continue on this journey though, and I love that you're looking for more information. And I hope it doesn't sound patronizing if I say to you, I'm really proud of you for sticking with what you think to be best and know to be best for your baby and pursuing more information. Maybe we could talk a little bit about harm reduction. So this would be ways that we can reduce impact on baby, not just for yourself utilizing cannabis, but also your partner or family or friends.
Yeah, that would be great. Because, the partner says they don't need to worry about it because they're not breastfeeding, so what's the big deal sort of thing. So.
Excellent. That actually brings us into our first key point, which is reducing exposure, both for yourself and baby, to that secondhand smoke. And so you know that the particles can remain on skin and on clothes and still have some impact, but particularly when we're breathing it in. I would like to offer encouragement for your partner or family or friends if they are smoking to be doing it in a different area than yourself and baby. Other strategies can be requesting a reduction in frequency or the amount of cannabis smoked, both either for yourself or your partner. That avoiding it near the baby is a key piece, and a beautiful way that we can hold that up is we always want to take the safest route possible that we know. So, a century ago, we were still smoking around babies. We were drinking alcohol during pregnancy. And if we don't look at that through a villainous lens or a bad guy lens, we really look at it as everyone doing the best they had with the knowledge they had at that time. So right now, because we don't have any conclusive studies showing safety in cannabis use, we can exercise that caution by reducing the amount of exposure to it. Does that make sense?
Yeah, it does. And, I know some families that, a couple people's houses that I've been to where they basically said, no smoking, even tobacco, in the house, that they have to do it outside. And, just as you were talking, I was thinking like we actually have a garage that's heated and it's separate to the house. So I'm thinking maybe I can just kick them all outside and make them do it out there. It doesn't help me as far as, me wanting to do it or not do it, but at least like from the baby's point of view I think, I think I'd be willing to cut back, and maybe, sometimes I just do it because I need to relax, and feel really stressed and, using it just helps me relax. So, maybe there's some other ways that I can, deal with my own need to relax. And then from the point of view of the baby, and I think as my partner is, is involved and is really happy about becoming a dad. So, I think if I push more around, it's not so much about me, but the baby, maybe that will kind of get through the thick core of not wanting to change practices and stuff, and see if they're willing to just use outside.
I love that. And I love keeping the focus on the most vulnerable person in this equation and creating as much safety for them as possible. I really hear the way that you love your baby coming through in the way that we're looking at making these plans. And I do want to say to you that if you are choosing to utilize cannabis, another harm reduction strategy is to wait as long as possible after use for breastfeeding. Again, because that release of THC can happen anywhere up to 6 weeks. There's no perfect science, but we know that giving as much time as possible is also very good at reducing potential harm. And of course, breastfeeding has so many benefits for both you and baby, including improved immunity and bonding. But ultimately, this decision is yours. No one else's. Maybe you might want to consider discussing this further with your physician, or seek multiple opinions, as many as it takes for you to feel confident and comfortable in your decision. I'm going to offer these evidence-based resources. And I just want to remind you that I'm here as a safe place to have these conversations. I do thank you for trusting me with it. And maybe in the future, we might have some conversations around co-sleeping while utilizing cannabis, more information on secondhand smoke, and also how we might safe parent while utilizing cannabis, and make those plans for the future. But I feel like we've had a big conversation today. Can I ask you, is there anything you would like to revisit or that wasn't clear?
No, I think I've got some homework to do. Would you be willing to, if I was able to convince my partner to come in and see, like we come together and talk with you, would you be willing to talk to him too? Maybe he'll listen to you better than me.
Yeah, I would love that. Let's all get together and see how we can move forward safely.
Okay.
Okay.
Sounds good. Thanks.
Okay, there's our second conversation. Always a tough one around any substance use with breastfeeding moms. Did anybody have any follow-up questions, or maybe you've been thrown a curveball in that conversation before? Okay.
I think one of the things that, could come up, let's say in the
sorry.
next session.
I just had another comment that I'd like to make. Sometimes some of these new parents are living in other people's homes and they don't have a say of who can smoke where in the house. And I find that is an issue for the new mother, at least, or life giver, to be able to say, to make any rules. That's just something to keep in mind. How do we deal with situations like that? Because housing is an issue for Indigenous people.
Yeah, that's a really good point, Lucy. And maybe, part of that could be, from a healthcare provider or some community worker, is not just working with the family, but working with the community to kind of, build that understanding around what's safe for baby and what's not safe for baby, and sort of the public messaging sort of on a bigger level that, may or may not work, but be able to give some ideas. You're on mute, Lucy.
Oh, that's a good point. For those living on reserve, and it's good to see some of the communities trying to kick out the drug pushers and at least trying, whether they're success or not, and also to see policies like Lil Watt, which is Mount Currie, who has a policy of no smoking inside public buildings. So that's another good start as well. And I don't know if all communities have that.
Yeah, exactly. I mean, I think there's kind of the small work that we can do, and then there's the bigger work that can be done to try to move forwards, and sometimes I know in the hospital, when I had students in the hospital, and there was one family, and it wasn't an Indigenous family, it was coming from a different background, but her talking to her mom wouldn't really listen to her, and she was trying to do more Western ways of doing things, but she said, if you tell my mom that I have to do this or I can't do this, they'll listen to you because you're the healthcare provider. So sometimes our quote power that we don't really want to be emphasizing or using, but sometimes we can influence if we do it sort of in an appropriate way, and a relational way, and not in this case, the person wanted me to be specifically tell the mother, no, she can't do this, or yes, she can do this. But that was okay because I was told I could do that. But, generally speaking, I mean, again, maybe building up some support within the community of different elders and community members that would be willing to, raise the flag for, supporting breastfeeding and the issues around smoking and whether it be cannabis or even tobacco. So some things that could be worked on. And just one other thing I wanted to bring up too was around, and we didn't have time to pull through today into the conversation, but again, finding out the reasons for the person wanting to use the substance, whether it be alcohol, cigarettes, cannabis, or whatever, and then trying to target into that. So, again, like I was sort of saying to Toni that, it helps me relax. So then, maybe there's some other ways of, in that case, getting the mom to be able to relax. Or if they're using it because of pain control, well, maybe there's some other issues that need to be assessed around pain. Maybe somebody's told them that it's normal to have pain, for umpteen weeks after the baby's born, when in fact it shouldn't be. So is there other measures, other substances, safer substances, that, can be used to deal with that? So just again, finding out where they're coming from. Is it an issue around not wanting to have these difficult conversations with their partners, or the partners there ends up being some discourse between the couple, and so they just don't want to rock the boat, and so that gets into another bigger conversation around, the safe environment that you're living in with your partner, or maybe it's not safe. So beyond today, the scope of today, but things to think about.
Yeah, I think that's a really good point, thinking back on, so many of the mothers I've worked with, and, just entering into some of those conversations to find out, what they're worried about and how things are going at home, and are there pressures, and also, some mothers I know use cannabis for anxiety and depression. And so having some familiarity with the Edinburgh postnatal depression scale, and just, asking some of those questions. How are you sleeping? Are you sleeping? Is your partner sleeping? Things like that. And just, asking some more superficial level questions, because sometimes there's an unmet need for mental health supports and medication. So, it's a good way to start that conversation.
Yeah, that's a really good point. That's a really good area to focus in on. We didn't bring up about pump and dump today. We talked about it yesterday. So if you weren't at the webinar yesterday, they will be posted once I can get them onto the gathering space. They're big documents, and gathering space is giving me grief. Stop laughing, everybody. We know gathering space is a pain in the neck, but we will work through it. And certainly there's more information on it and all the different resources that we've hyperlinked and stuff. So, pumping and dumping, just the short version of pumping and dumping, does not get the medication, whether it be cannabis or alcohol or whatever, doesn't get it out of your system faster. All you're doing is maintaining if you're pumping while you're using, is just maintaining your milk supply. You're dumping it because you don't want to give that to the baby, but you don't want to lose your milk supply. But it's not going to make anything get out of your system faster. So, okay, moving on to the next one.
Just before we move on, Lucy's put a wonderful question into the chat there. Lucy, would you like to read that aloud yourself?
Sure. For generations, our traditional practices kept us strong. Praying, singing, dancing, drumming. We had our own spirituality and our own traditional medicines like sage, sweetgrass, cedar, and other that helped us to relax. And perhaps some of our new families have these as practices, and maybe they feel they don't deserve to practice these if they are using drugs or alcohol. But from a harm reduction approach, it is important to let them know that they can practice their spirituality and their practices anytime they wish, because that helps them steer closer to what we call the red road of not using drugs and alcohol.
Lucy. One last thing to Lucy's point about multi-generational housing, which for those who are working in community, or perhaps not even, that is a barrier that we see. I would like to highlight one program that a Indigenous community does, where all of their baby time events are entire family welcome. So they invite not just mom and her babies, but they invite the extended family. They do a big catered lunch for it. They have hilarious door prizes and they ask questions. And it's really fun to see aunties and uncles competing to answer these questions, these prenatal based questions. And because they have some door prizes and raffle prizes, but the belief is that healthier communities mean healthier families. And so just spreading out that knowledge and stopping looking at it as mom and baby or mom and me time, but the entire community lifting up a child. And one of my favorite things from one of these that I attended was, just someone was teasing an uncle, and he said, "Quit teasing me, you're stressing me out, my milk's not going to come in." And everyone had a good laugh, but it was such a wonderful highlight to just the level of increased knowledge after that one community lunch. So putting that forward in response to Lucy very wisely pointing out that oftentimes it isn't just mom and her partner in control of the environment. Okay, I'm looking to Barb and I'm looking at the time and I would like to ask what you would like to do.
The breastfeeding in public we could do really quickly. Just do kind
Okay.
of a quickie one on that one and then finish up with the other one.
Absolutely. So, okay, I'm going to be the mom and
Yep.
I'm going to look to our MCH nurse for some help.
So welcome, Toni. I understand you're feeling some anxiety around breastfeeding in public. So I'm just wondering if you're willing to share a little bit about what makes you feel anxious. Like, is it things, maybe you've heard some stories that are concerning you, or that you just never done it, or anyway, something, if you're just wanting to give it a little bit more detail as to, what's making you anxious about the idea of breastfeeding in public.
Well, no one in my family breastfed. They used bottles, and my partner's family has conservative views about breastfeeding. And so I've seen already other women in the family being told to go to other rooms or cover themselves up or lock the door. And I saw some things on Facebook about moms being shamed, even breastfeeding, like in a restaurant, one of them. And so I really don't know how I feel about doing this. I don't even know what I would do if somebody got mad at me for feeding my baby. And I'm wondering if this might even be the right choice.
The right choice to breastfeed or not.
Yeah, I don't want people attacking me if I'm feeding my baby.
No, certainly you don't. And you've got some, really good reasons to be concerned or anxious from, what you've read and what you've heard and, family. So it's kind of those messages are coming to you from different directions, which can be even harder for you to, but perhaps we can, kind of work through some of these and try to get you to feeling more positive. So one of the things you need to know, and you may not be already aware of, that that breastfeeding in public is legal in Canada and it is protected. And you have the right to feed your baby whenever and wherever you need to. So that's something to remember. That's not to say that, we still hear the stories of mom being in a restaurant or in a library or different things that we hear on the news where it doesn't always fall, doesn't happen. They still get told to, some misguiding security guard tells them to leave or whatever. However, you've got the right to do it behind you, to be able to, again, it can be hard to confront these people and say, no, I've got the right to be here. But maybe just knowing that you've got that right might give you some extra positive feelings that you're doing the right thing and they're the ones that are out of step. Have you had any conversations with your partner or with the family, like the family, around what your ideas are around breastfeeding and how you would be, you would like to be able to breastfeed anywhere?
No, I'm kind of too scared to. I don't know if everyone's going to get mad. They seem really mad about it.
So maybe having, before the baby comes, it might be a good time to, as much as it's kind of scary to do this, but it's before you're forced, well, not forced, but before you're having to breastfeed somewhere and then be told off because they just don't understand. Maybe having sort of a broader conversation with them as far as them understanding more about breastfeeding and the pros of the positive aspects of breastfeeding and how babies need to eat little and often, and that's really good for their little tiny tummies. And that that you would really like to be able to participate in family functions and not be locked away in a bedroom where you can't hear the conversation and hear the laughter and the joy of whatever the occasion is that you're going to, and that your plan is to be able to do it discreetly to honor that they may not be comfortable with it, And, having some of those kind of conversations as far as, and see where they go, maybe prepping your partner first. Are they an ally for you? Are they okay? What are their thoughts about you breastfeeding in public?
Um, I think he would be. We haven't really talked about it very much.
So that might be a starting point to talk with him and see how he feels. And and then give sort of some positive reasons why you're wanting to do it and how it's many people do it. So it's just that they're not used to it. But it's not to say that lots of other people don't do it. So you build up his trust and support, and then kind of move forward from there. The other thing you can do is, just kind of keeping in mind, breastfeeding in the first couple of weeks can be a bit more challenging. And, lots of times women feel like you have to basically pull off all your clothes from the waist up and need 6 hands to get this baby on the breast, which sounds like a lot of work. But once you and the baby get into a rhythm and, baby learns how to breastfeed, you learn how to breastfeed, then it can be done, as discreetly as you want to. So again, looking at the timing, that maybe while you're still practicing and baby's practicing, that you, do it more privately. And so then, and once you're becoming comfortable and baby becomes comfortable, then that's when you could, option to be more public and do it around people that are going to support you to begin with. So if you've got some friends or other family members that are not going to say negative things, then practice with them first as far as doing it in front of them or when you're at their house. You can always wear comfortable clothing, there's lots of nurse friendly type clothing, or, a shirt or something backwards with the buttons up, open up the front. There's nursing bras where you just open up the little, you don't have to take the whole bra off. You just open up the flap. You can always put like a blanket sheet sort of over top of the baby once the baby's latched on, so that you really don't see anything. Wearing a bikini, you're going to see a lot more than what you're going to see with a baby latched on. And, you can always find a place off in the corner of the room. Like, you don't have to be right in the center of the room. So, coming up with some strategies that you could use to make it so that you feel comfortable. Another thing that may make you feel uncomfortable is, whether or not you've had any past any trauma around within relationships, or just perhaps the family may have had, history of trauma where something like this, it just sets off triggers for them, not specific to breastfeeding, but just more other situations where, their bodies were exposed when they didn't want them to be. So that's a conversation we can have in more detail. Maybe next time we could meet again and talk about it in more detail. But that's kind of another avenue that, maybe, causing some of the discussion that's happening, or the responses that they're having when people are breastfeeding. So, and I can give you some information on it, and some pictures of, how to do it discreetly, so that you can have those conversations with your partner and with the family.
Okay, I would like that, because I do want to breastfeed. I was just really nervous about people getting mad at me out in public.
The other thing we can do next time too is come up with some, if people do say something to you, what are some things that some comebacks, like some things that you could say or do to respond to that, so that you feel in a good place where you're able to not feel that, someone's being mad at you, that you're able to portray that, I'm doing this because this is the best for my baby and this is what I want, and feel proud and of what you're doing. And so we can maybe get into more different things you can do or say to be able to promote that. So that kind of turns it around from you feeling vulnerable on this occasion to being strong on this occasion.
I really like that. I would really like to practice because I'm
Okay.
not very good in the moment.
We can practice, and certainly I'm here to, obviously, as you already know, to help you with feeding, feeding and breastfeeding after the baby's born. So, we can discuss it when you're feeding the baby and stuff too. So,
Barb,
okay.
could you, I think
Yep.
you partly touched on this. Did you see Lucy's new comment about discomfort?
Yeah, I can't read and talk.
Oh, okay. No, because
Yeah.
you at the same time you did touch on it, so I'll just read it aloud. There is still discomfort from the intergenerational families who experience sexual abuse, physical abuse, and other abuses in residential schools that don't like to touch their own body or even see others. And we need to heal from these feelings or thoughts of our bodies being ugly. Lucy, I just had a quick question for you there. Do you think with young moms starting to feel more comfortable to breastfeed in public, do you think that would be part of the healing process? Like,
Oh, for sure. And I think the younger generation are not afraid to breastfeed. And those are women, that, have a lot of the answers already to their questions. But
Yeah.
it's about those that are still on their healing journey, whether, they're still using, or if they're using drugs and alcohol, regarding the trauma that they've experienced within their family or community systems. These are the ones, that's why you see so many people on the streets in the downtown. They left home for a reason.
Yeah.
And they're hitchhiking for a reason. They're getting away from something. So there's still a lot of healing that needs to happen. And I know there is still some shame in people showing their bodies.
Yeah.
And also could be a cultural thing too. There's that little balance, women usually aren't, to show off their body parts. Those are for sacred times, kind of thing.
Okay.
There's that little balance of knowledge, traditional knowledge, and abuse.
Yeah. Thank you.
There's a good article that I've read around past trauma, especially around sexual abuse, and how breastfeeding may be able to change their thoughts. I mean, I think of it properly. Just change the way of them thinking.
Yeah. To create positive experiences.
Exactly. That's what I'm trying to think of. Thank you, Aiden. I know we're here as a team for a reason. And again, it may have to be some strong conversations first before they feel comfortable even getting to that point of breastfeeding or breastfeeding in public. So again, great where you have these conversations with parents during the pregnancy and not waiting until after the baby's born and then all this comes out and then we wonder why there's lots of different potential issues or concerns and frustrations from mom or the family, which kind of leads into our last one, which of course now in 3 minutes to go we won't have time to but it was around supporting a mom who's not producing enough breast milk or any breast milk. And again, the knowledge and having that information during pregnancy can be so vital to sort of set them up in a good place, in a positive place of understanding what are the norms. And going back to the first scenario we did, it kind of fits in with this one too. And how do you know if the baby's got enough and all those different indicators that are going to tell you that the baby's getting enough. And that sheet that was one of the ones that was posted around the baby's breastfeeding guide can certainly help you with that one. But then there can be other conversations around there. There's other reasons why maybe there isn't milk supply and maybe there needs to be further investigation by yourself or other healthcare providers as a reason for that. But I think, some of it is, again, hopefully what you're seeing from the different ones the ones that we've done already is building up that conversation with the family, or the mom in this case, finding out where they're at with it rather than before we start spewing all the information that we know about everything. finding out what their needs are, where they're coming from, what they already know. There's lots of myths out there. There's lots of bad information out there. So, where are they coming from, and working on that first, and building up from there. And then, zeroing in on what fits for them. And Toni, what else do you want to add around that?
I just want to loop us back to my question for everyone, which is something that you have heard, not today, but just anytime, or even might have been said to you about breastfeeding that was really impactful and to get us there. Part of our last conversation that we skipped, one of the best things ever said to me as I struggled to produce enough milk was a lactation consultant who looked at me and said, anyone with eyes can see how head over heels in love with that baby you are. She is going to thrive whether you breastfeed or bottle feed. You're doing everything right, mama. And no one had said that to me in my 3-month struggle. So it was hugely impactful. And I would just like to turn it over to you guys and ask you if you might have a moment to share with your peers on here, anything, help us fill our toolbox if you can.
And I know we're up on time, but if people want to put something in the chat, great. If you want to message mchnursing@fnha.ca, that's also great. And we can also bring up the information tomorrow in the webinar if you send something overnight. And tomorrow's webinar, we've got 3 mothers coming to discuss their stories. And so some of these things will be teased out, I'm sure, in the conversations tomorrow in one way or another, and we can delve into some of these empowering conversations, or they might be alluding to conversations that weren't empowering, that they found stressed about. So again, the conversation I don't think is finished from today. I think it really feeds into pun not intended, into tomorrow's conversation and tomorrow's webinar with the mums. So
I just want to share something that Beverly shared with us.
Yes, and I saw that. Yeah, thanks.
When she worked for the Canadian, when she worked in community, she used to cover nursing bars through the Canadian Prenatal Nutrition Program to pre-nursing mother, parent, and babe. They would purchase what they like and bring her the receipt for reimbursement because they're not cheap. And I think that's a wonderful idea. I wanted to make sure everyone heard about it.
Yeah, and I think it's not something that everybody's familiar with, that health benefits covers it. So that's what Beverly was saying, wasn't it? That was health benefits that covers it?
No, the CPNP program.
Oh, the CPNP program. Right. Yes.
Yeah, I will look into health benefits.
Yeah, I can't remember if health benefits does or not. No, maybe that's not that. They do nipple shields. They do a couple things. We'll have the answer for you tomorrow. You want to close us, Lucy?
Sure. I want to thank everyone, and Toni and Barb, for your excellent conversations. That's reality in our communities and with our Indigenous populations. Really important questions, and a great way to be able to make the client feel comfortable and safe within those conversations. I think this whole week has been awesome. It's something that is such an important topic to discuss because it is about health promotion, and it is our first traditional food that we need to stress, and that we need to change the way some people think that breastfeeding isn't the way. Unfortunately, some people do feel that way, but there's a lot of teaching that can be done in order to change their thinking on that. Thank you all, and thank everyone who has joined today in this virtual circle. Again, the last 2 days have been awesome. Tomorrow is going to be another awesome day with some moms sharing their experience. We look forward to that, and hopefully you can join us and share the link with your colleagues and even new moms. Just come on board. Okay, there you go.
Thanks, Lucy.
Yep, ciao.